right, Julie. I'm going to go off.
Yeah.
So good morning, or good afternoon now, I guess. We've run over.
Yes.
We're here today not only just to talk about the right to life, but also the broader issue around human dignity, which is tied to that. I think previous generations took for granted the right to life, and we are now at a point in time where the future generations can't take that for granted any longer, given the policies and the way the culture that's increasingly secularized views his life, and those who are physically or mentally challenged or disabled, or those who are simply too old to, in their own view or in the culture's view, contribute in some way to society. What we have up here are three panelists that have been fighting the good fight, defending life, defending human dignity on several different levels, on the grassroots, in state houses and in the governor's mansion, and in the public policy field here in Washington, D.C. So that's what we're going to discuss. Immediately to my left, I have Ali Stuckey, who's the host of Conservative Review TV. She also is a regular contributor to Fox News and Fox Business, and she also runs a blog and a multimedia hub called Conservative Millennial. Next to her is Governor Pete Ricketts. He's the 40th governor of Nebraska. Perhaps he's been long involved in economic liberty issues before he was elected. Perhaps most important, he was one of the Ricketts family that promised and delivered a World Series championship to Chicago. And finally, we have Julie Hawker. Finally, we have Julie Hawker, who's a senior policy fellow for the Center for Human Dignity at the ACU. Governor, let's start with you. You've come out of a legislative session where, at the baseline level, you were engaged on the defending the life issue and trying to restrain the federal funding and taxpayer dollars for abortion. If you could talk about that.
Yeah, absolutely. In fact, we're still in the middle of our legislative session, so we still have work to do to make sure the language I put into our budget remains in there. And what it was around was the Title X funding. This is dollars that come from the federal government. The state acts as a pass-through entity to provide that health care. And last year, the Congress passed and President Trump signed House Joint Resolution 43, which gave the states more flexibility with regard to how we can direct those dollars. And as Nebraska is a pro-life state, I believe our budget should reflect those values. So I put into our, into our budget language that we would not provide those Title X dollars to any organization that provided abortions, referred or directly counseled for abortion. And that is really just taking the next step of saying, hey, these dollars are supposed to be completely separate from abortion and abortion providers. And even if you're not using them specifically for it, money's fungible. And if it's helping to pay for the rent or the utilities, you're subsidizing abortion. So we want a clear line, a clear marker between the organizations that are providing abortion and where these dollars are going, and that's what we put into our budget to reflect that. And so that's one of the ways that we are trying to live our pro-life values in Nebraska. And I think it's really important that we to your point, not take for granted that right to life, because our founders absolutely envisioned that was part of what made this country special. And we have to fight for it every day in different ways, and we need people to stand up and say, hey, this is important. So we've asked people in Nebraska to contact their state senator and say, hey, make sure this language stays in the budget. Don't let the other side take that language out. This is important language to keep to make sure we can direct those dollars to organizations that are not performing abortions.
So, Ali, increasingly in the pro-life movement, we're seeing younger people becoming much more energized and engaged. And
Right.
They say that the millennial generation is also the life generation. And that we're seeing that in the U.S., but we're not seeing that everywhere else in the world. So, why do you think that in other places, and even here in the U.S., the notion of whether it's abortion or assisted suicide is becoming so prevalent and accepted in the culture?
Yeah, so I'll kind of back into that question. First of all, I think it's such an honor to get to talk about this subject that, like you said, is increasingly pressing and is always hanging in the balance in our politics, is always being threatened to be kind of disregarded as this hushed conversation that we can only have behind this veil of euphemisms like bodily autonomy. So the fact that we're having this open conversation right now means that there is still hope, like you noted. So let me just kind of give some perspective about where I think we are and why it's so important, not just for millennials like myself, but for everyone to care about this subject. So first, track with me for a second, because it's going to seem like I'm not talking about abortion, but I am. So I just saw The Second Godfather for the first time this past week, and there's this conversation. If you haven't seen it, you should. But there's this conversation that two main characters are having, Kay and Michael. And Kay compares her abortion, or compares her marriage to an abortion. She calls it evil and unholy. And that just struck me, because how far have we come in 45 years, not just since the movie was made, but since Roe v. Wade, from calling an abortion evil and unholy to calling it reproductive freedom, to calling it women's rights, to calling it privacy. But what you and I know is that no amount of political correctness, no amount of manipulation can hide the fact that just one abortion provider is murdering over 1,000 children every single day in this country. Abortion, the principle of abortion, is literally why we look in disgust at Hitler's Germany, for example. It's the same exact principle of having a subjective standard of human worthiness and exterminating anyone who doesn't meet that standard. That has literally been the mark of every dictatorial and depraved regime and nation since the beginning of time. And we look back at history in shame on those crimes against humanity. But why today do we not look in shame at where we are right now in 2018 in the United States of America, not just allowing it, but normalizing it, glorifying it, and calling it choice? And if you think that our absolute apathy and disregard for human dignity stops with life inside the womb, unfortunately, you are wrong. There is an abortion advocate. He's also a bioethicist. He's a professor at Princeton, and really the leading intellectual and academic voice for abortion. His name is Peter Singer. I also say that he is one of the only honest abortion advocates as well. So his argument for the moral acceptance of abortion is that the baby inside the womb, he acknowledges that it is scientifically a human being, but it does not meet the standards of personhood, and that is rationality, autonomy, and the ability to be self-conscious. So he says, because of that, because they don't meet the standard of that personhood, then life inside the womb doesn't really have any rights. And here's where the honesty comes in, because most pro-choicers would probably agree with that, but here's his honesty. He says, if that is our standard of human worthiness to live, then logically we have to apply that to everyone, to life inside the womb and outside the womb. So he is an open advocate for infanticide. He is an open advocate for terminating people with severe special needs and severe mental illness because they don't meet that subjective standard of personhood. Now, you're probably thinking, okay, well, he's radical. That's a radical pro-choice stance, but it's actually not. It's becoming mainstream. Last year in January, the House passed the Born Alive Survivors Protection Act, which says a doctor who is performing abortion has to save the life of the child who survived that abortion, so outside the womb. All but 6 Democrats in the House voted no to saving the infant. To show you where we've come, back in 2002, a very similar, if not stricter bill passed the House in both chambers by just a voice vote. So that's where we've come now, and I'm wrapping up because I know I don't have that much time. but I want to create a segue. Now, most pro-choicers prefer that life is terminated inside the womb because the PR strategy for Planned Parenthood to be openly pro-infanticide is a little bit tricky. So they prefer that life be terminated inside the womb, which is why they're completely fine with places like Iceland having a 99.9% rate of terminating babies inside the womb with Down syndrome. That's why they're okay with it happening here at a 60% rate. And if you don't think that that's going to eventually extend to people with autism or different kinds of special needs, then you're absolutely blind. And here's why this matters. Here's why human dignity matters. Here's why it's important that we don't set some subjective, arbitrary standard of human worthiness that people don't meet. One, because we've already joined the ranks of North Korea and China in being one of only 7 countries to allow abortion after 20 weeks when a baby is known to flinch from the abortion needle. But also because without life, not a single one of our rights granted to us by God and guaranteed to us in the Constitution is secure. Every single one of them is at stake. And the founders knew this. That is exactly why in the Declaration, life is listed before liberty or the pursuit of happiness, because without life, without the protection of life, the understanding and agreement that human dignity starts in the womb, neither liberty nor the pursuit of happiness exists.
So Julie, this isn't just a moral or ethical issue, it's also a political issue.
Yes.
Could you talk a little bit about kind of the dynamic now that we're seeing with assisted suicide, the other end of the spectrum here, perhaps?
Absolutely. Ali brings up a really, really good point, and it's a point that's often overlooked. There is a yardstick, and we shouldn't be fooled that there's not. It's subjective, and it is meant to separate people who are protected and defended by our Constitution and those who are not. And when we look, we focus a lot on the unborn, and we need to continue to protect them with all of our might. But make no mistake about it, that video that you watched right before we came out was just touching the surface. When it comes to end-of-life issues, we are being lied to as a society every single day about this issue. This issue of physician-assisted suicide is being sold to you as compassion and dignity for people facing terminal illnesses. That could not be further from the truth. That's right. Physician-assisted suicide laws do not contain a single right or protection for patients. They only offer cover for doctors to take out a small piece of white paper and instead of write a prescription for medicine, for a device, for a treatment, for a referral for help, they simply write RX, death, and you take it to your pharmacy, and for $1.20 copay, you can go into the night and die. And when you're told that that's compassionate, you need to continue to go underneath the surface. And I want to touch on what's happening in Oregon really quickly to paint the picture here. In Oregon, this law has most unfortunately been in existence for 20 years. And when we dive into the data, and the data is all voluntary, so I don't even know how good it is, but there's one thing that I got out of it. Number one, you don't have to be terminal to access this medication, and mark my words, they will continue to expand who can have access to it, and they will include people who look just like me. They will include people with disabilities. That is who they are after. But when you dive into the bill, what you find is the most disheartening, most lacking compassion and dignified deaths. Because when they tell you that these laws are to help you end intolerable suffering, then ask yourself this: when surveyed, patients who take these prescriptions, they do not list pain and suffering as the number one reason that they ask for that prescription. They don't list it as reason number 2. It's not 3, it's not 4, it's not 5. It takes to reason number 6 for them to list pain and suffering as the reason. The first 5 reasons all go back to one of the most disheartening facts that I was sharing with the governor earlier today. It's a cry for help. I have a loss of community, a loss of sense of being able to do what I enjoy. I'm sad and anxious. We've been there. That's understandable. And what's most disheartening is 1 and 2 say, I'm choosing this because I feel I've become a burden to my family and my community. We can do better than that. We can do better than laws that say to people, we can do better than laws in the United States that tell people that the majority of people are worth helping with mental health resources, that the majority of people are worth referring for counseling and help and community resources, but that there's a subgroup of people that are in fact better off dead. When we begin to create that group of people, we do begin to see the end of our society as we know it. And I want to wrap up that comment by pointing back to something that our president said on this stage yesterday, and it's a charge that you all should take seriously and take back to your communities. He said, we need to create a culture in our country that cherishes life and human dignity. I guarantee you, these laws are coming to your states. They do not cherish life, and they destroy human dignity.
Thank you. So, Governor, to what Julie was saying, there's more here on a cultural level than just a desire on the part of some part of society to just eliminate people. There's some underlying challenges here, and you've been kind of dealing with them in Nebraska. And part of this, given your career with in terms of promoting economic opportunity, which helps sustain families, which keeps families solid, which gives people additional opportunities for better jobs. What have you been doing in those areas to kind of rebuild the society and the safety net in Nebraska?
Yeah, absolutely. So you're exactly right that everything we do in government should be reinforcing that value of human life, that dignity that we all have that comes to us from God. And so our government should express that and deliver on that. We talked about what we're doing on Title X, but we also, for example, have passed the compassionate care for medically challenging pregnancies. So when a woman has the diagnosis of a fetal anomaly that's going to end in death, we now provide resources and services about perinatal hospice service, for example. We also do it reflecting the way we serve people. So, for example, we've reduced the time on hold to be able to help people who are seeking economic assistance from nearly 24 minutes on average before I became governor to now getting our goal of 5 minutes or less for 25 out of the last 28 months. Demonstrating to people that we care about them and we're going to serve them well. Another great way that we're doing this is in our jobs program. Our Department of Labor has turned our unemployment system into a reemployment system to help people get back to work faster by sitting down with them, creating a resume, having that resume posted online so that they can quickly get a job. We've reduced the amount of time people are unemployed. We give them job training pointed toward resources for that, how to find the next better job. We've reduced the amount of benefits paid by over 20%. We've reduced the number of people reaching the end of their benefits by 30%. And because we were able to do that, we were also able to reduce our unemployment insurance tax by $25 million, saving 25% rather, saving $25 million or $20 million. So that's a win-win-win for everybody. Person gets a job, company gets an employee, and you get taxpayers saving dollars. We're taking that same program now and applying it to our SNAP program, the Supplemental Nutritional Assistance Program, the food stamp, to help those families get a better job. Using the same jobs coach, we've been able to help about 25% of the families who volunteered for this to be able to get a better job to the tune of $10,000 a year or more and be able to reduce or eliminate their need for food stamps and frankly just have a better quality of life. We had a woman who was a single mom in Grand Island. She was working part-time jobs, making $900 a month, and with no benefits, no pension, nothing like that. We got her into a job paying $2,700 a month with a pension, with benefits, potential for bonuses, and best of all, regular hours so she can be at home at night with her kids so she can have a better quality of life. That's delivering on a true pro-life message for how government works, how we're respecting the dignity of life and helping people live better lives.
So we're gonna wrap up here. We've got a few minutes, but each of you at some point has probably heard the attack from those who say, you can't be pro women's rights if you're pro-life.
Right.
You can't be pro-life and be supportive of the death penalty. The knocks on these issues that kind of try to delegitimize your position on one issue versus another. I mean, how do you address the issue related to being supposedly pro-women and, you know, pro-life?
Right. Well, I think it's a false binary to say, or they're really kind of giving you a false choice between either you're for abortion or you are against women, and that's not true at all. I don't think that dismembering your child inside your womb is empowering. I don't see how that equals equality at all. I am very pro-woman, and I'm not just pro-life for the child inside the womb. I am pro-life, as you were saying, for the mother as well. And the beautiful thing about the pro-life movement is that it doesn't just cover the child inside the womb. There are so many clinics who offer wonderful services for not just the baby inside the womb, but also for the mother that's contemplating abortion, completely and absolutely free. I believe in ending the cycle of abortion by loving the mother as well and helping her, providing her with the ability to get a job, with providing her information about adoption services, making sure that she's cared for as well, not just through the government, but also through volunteer organizations and nonprofit organizations. And that's what I think that we need to do a really good job of addressing, both the mother and the child, making sure that we're loving them both. That's women's rights. That's empowering to me.
Julie?
Yeah, so there's a really good argument out there, and it's catching on in the state of Oregon, where there really is a death culture, and they're called vitalists. And they'll say that you're either for allowing people to choose their time of death, or you're a vitalist. You want to keep people alive at any cost. That couldn't be further from the truth. By being pro-life for the end of life and standing up for our most vulnerable populations when they face some of the most difficult diagnoses, it doesn't mean keeping them hooked up to every machine. It actually means respecting and valuing them as human, living, breathing beings. That does not require us to keep them alive at any expense. In fact, being pro-life for the end of life means supporting hospice care. We actually know that when folks get into hospice care early, that they report they're in less pain, they suffer less, they sometimes live longer, and they report better quality of relationships with those around them. We also know that when individuals and their families begin to talk about dying as a stage of living earlier, that after 6 months after the person has passed, the family reports far less likelihood of suffering from major depression disorder. There's one final thing that we should talk about and we should mention that has nothing to do with being a so-called vitalist, but rather respecting the dignity of folks who are facing terminal diagnoses, and that's the right to try. The right to try simply says that when the FDA has approved a drug as safe and passed phase 1, if that drug remains in trial through phase 2 or phase 3, and you have exhausted all of your options, and there's a drug that may help you, you and your doctor and the drug manufacturer should be able to have that conversation and allow you to have access to that medication early. And I implore each of you, and I'll wrap up on this, that's something that you can do. The United States Senate has already passed this law. We are waiting on the House of Representatives to act. And you can go home and you can call your congressman today and you can say, get this to a vote.
Great. Governor, you started this, now you can bring us home.
Well, I'll just kind of wrap up on, you mentioned the death penalty as well. One of the key things that we do in government is protect the public safety. That is about, protecting everybody in our society. And the death penalty is very different from what we're talking about with regard to, say, the pro-life issue, because we're not talking about innocent life here. We're talking people who've endangered the public safety, committed heinous crimes, and part of our role in government is to protect society from those people. And the death penalty is one of the ways we do that, especially if you think about our corrections officers who go into our prisons to keep these inmates, secure. They're protecting the public safety. They're heroes every day that do this in a very dangerous environment, and that death penalty helps protect them as they're dealing with these very dangerous individuals. So it's an important thing to protect the public safety. It's very different from what we're talking about when you're purposely going in and ending an innocent life of that child.
Great. Thank you very much for being here today.
Thank you.
Thanks the audience. It was great.
Thank you.
Thanks. Great. Thank you. Great job, Julie.
Thank you.